With news from the United States, after returning to White House from Walter Reed Hospital, the status of the U.S. President's health and recovery from the coronavirus is still not clear due to lack of complete information from the White House. Donald Trump is now said to have developed antibodies for the coronavirus. White House press secretary released the information through a letter on Wednesday, informing that Trump's blood test from Monday showed Trump had coronavirus antibodies. Antibodies are produced by the immune system in response to germs and are generally a sign that the body is fighting an infection. The letter also stated that the president has not had a fever for more than 4 days. While at the Walter Reed Medical Center under treatment for COVID-19, Donald Trump was administered with an experimental antibody cocktail. Trump received a single 8-gram dose of Regeneron's polyclonal antibody cocktail. The drug, which has not been cleared by the Food and Drug Administration, is being hailed by the U.S. president, who says getting infected with COVID-19 was a blessing from God. Trump attributed him feeling well to the experimental antibody therapy he got from Regeneron Pharmaceuticals and that he's working on an emergency use authorization so that other people suffering from the coronavirus will be able to get the same drug.
I spent 4 days there, and I went in, I wasn't feeling so hot, and within a very short period of time they gave me Regeneron. It's called Regeneron, and other things too, but I think this was the key. But they gave me Regeneron, and it was like unbelievable. I felt good immediately. I felt as good 3 days ago as I do now. I think this was a blessing from God that I caught it. This was a blessing in disguise. I caught it. I heard about this drug. I said, let me take it. It was my suggestion. I said, let me take it. And it was incredible the way it worked. Incredible. And I think if I didn't catch it, we'd be looking at that like a number of other drugs. But it really did a fantastic job. I want to get for you what I got, and I'm going to make it free. You're not going to pay for it.
Experts, on the other hand, say that the presence of antibodies does not provide information on the president's COVID-19 recovery, and it's not an indication of how Donald Trump is recovering.